I'm sorry.
Actually, let me get some of the thoughts.
Sure.
Governor Temple?
If there is a real dispute, who resolves it?
Nobody today.
Well, what, it used to be
do.
the chancellor, right? And
You do.
carve that out.
The Board of Governors.
So we have to bring this back to the whole Board of Governors to approve it. That's the way this reads.
Yes.
And how many of these kind of things are we going to have? Do you think? I mean, is it
I don't
dozen
think
a year or
I don't
one
think
a
you're
year?
going to have many. I don't know. It's difficult to quantify. I don't think you'll have many. I think this is only when people at the local level can't resolve the issue themselves, which is, as I said earlier, more often than not the case. But in those cases, how many of those? It depends on how fast we grow and evolve and change. Remains to be seen. Don't know the answer to that.
Governor Tripp?
What I understand, and I've seen it enough now, is the haves and the have-nots have issues with this, okay? And I say that in a positive sense. I can understand why MJ can be concerned if University of Florida comes in and starts offering something. I can understand that. And I can understand why President Ammons gets concerned if he feels FSU is doing something and he hasn't talked about it. So why don't we do this? It's their problem. It's their issue. They're the one that raises it when it comes up. So why don't we ask them to get in a room and come back to us with a suggestion of how they see themselves governing this issue of movement in space. And they won't all be happy about it, but take a vote somewhere and the majority wins. And so we'll live with it a little bit. I mean, because that's what we're asking them to do anyway. Every time there's a problem, we're saying, talk about it. So why don't they set up the format?
Well, the problem has been, in my instance, and my only concern about the recommendation that you would have is because ultimately the responsibility to ensure the well-planned coordination and operation of the system and avoid wasteful duplication of facilities and programs rests with this board. And so ideally for each person, but their recommendation, if I were them and if you asked me to sit in the room and figure it out, I would have all the responsibility lie and stop with my local board. Because that's what I would do. I mean, because that's a lot easier. But because that obviates our responsibility to sit somewhere and just kind of at least overlook, what's happening within the state, my concern is that let's have that kind of gathering, but someone from our board should be at the table.
But Judy is not going to allow that to happen in that discussion, okay? MJ is not going to allow that to happen. They are going to negotiate for the good of the order, and because it's movement within their districts that they get in conflict on.
Governor Tripp, I want to say that I believe the Board of Governors is the body that has the authority to sort out these issues. I don't think that's in question here.
No, I agree.
The question is, what are the issues and what should we do? And that's the thing that needs to be worked out.
And
But
that's
I
what
think
I'm
the
saying.
Board of
Why don't
Governors
you
has to
meet
drive the
and
boat
why
here.
don't you meet and discuss it
Well,
and
the
come
the
back
president
to us?
will end up in a little territorial
Exactly. That's what-
nowhere land.
Hold on
But
one second. What we're
you
gonna
can
do is-
settle it, but you got to talk to us before you settle it.
Exactly. I'm going to Governor, President Barron and then Governor Perez.
I think part of the strength of the system, and I think you saw it yesterday, is the diversity of the institutions. And the fact that some are aspiring are at great heights, aspiring to great heights, and others have a very selective mission and even a regional mission. And I think we really need to support that. I actually think it sends a very different message to the world and to the state that is not what Governor Colson was suggesting, to have this sense of regions. If I look at it, and I realize now that under this I would ask James and Judy, I'm combining these three programs and I'm going to create an environmental science program, and I'm going to ask them their views on this. Quite frankly, the four Tier 1 universities what they do has a greater impact on what I do and might not do, or how I would collaborate, because of who it is that we're actually competing with for research dollars or for students, than Judy. I don't want to tell Judy when she sends me a program whether she can do that program or not. I have to trust that she was hired to run a university, she has a particular mission, and she's going to live within that mission. It's strange to have a zone develop a mode of thinking which actually doesn't match the diversity of the institutions that are occurring there. I think that you could probably make this very simple if you wanted to. And that is, and maybe nobody else would agree with me, you build a building or sign a long-term lease, this should come to the Board of Governors. It suggests that whatever you're doing is going to a different level. And if that regulation was sitting there, I think I'd sit there and go, okay, before we think about this, this is what the steps we have to take. But if it comes down to a continuing education certificate, and I got the best real estate or risk management program in the world, why would I deny taxpayers in Miami access to that as a course? It doesn't make sense. And so I do think, and I think Governor Beard said it extremely well, that, we were after something specific. Well, also Governor Edwards, that we're doing something that is making it more complex when we're actually trying to tackle a specific problem, which in my view, in all three cases, was related to a physical presence of one of our universities near one of the other universities, which sends a different signal than offering continuing education by providing all our taxpayers with access to talent. Or some universities aspiring, 3, which had a statewide mandate for a long period of time. My personal feeling is South Florida and Central Florida, by coming into that Tier 1 status with their type of research, they are nationally aspiring universities and fit within that same ballpark. So,
Gotcha.
thanks.
Governor Perez?
Again, like the last regulation, and in the interest of time, it's coming up to 11:30, and in respect to President Manchin's comments, it seems to me that this issue may lend itself to be addressed the same way we did fees and market rate tuition, which is a blended task force of universities and board members. And I would ask that you consider appointing that as we move forward, because clearly there are other issues that need to be talked about that we're not going to do at the table today.
Right.
So I would ask that you consider appointing a task force to focus specifically on this issue, comprised of university representation, board, and certainly staff.
Thank you. Governor Hosseini?
Just the same thing as Governor Perez said. I don't think there's anything wrong with what President Manchin said. He agrees with the role of the Board of Governors. All he is asking is, let's do it in collaboration. And as the Governor Perez said, get the group together, go with the rules, and try to come up with an answer. And I think I agree with Governor Perez. I think it's a great idea.
Dr. Saunders?
I think that, in my opinion, what this came down to were who were the ultimate decision makers for academic programming within the SUS. And I've only been in the system for 1 year, and what I saw the decisions being made by were the college systems that invited in university partners that had more prestige or higher brand, that elevated the reputation of that community college or that local college over a neighboring partner. I saw local elected officials working with universities that they were alumni of or had relatives that were alumni of that they wanted to honor. I saw local businesses seeking partners with nationally ranked programs. And I saw legislators representing their regions and wanting to have academic programming in that region. And in all those cases, nothing came to the Board of Governors. And in all of those cases, there were co-located institutions that didn't have a voice in the process either. So in my mind, what the issues came down to was ultimately who is making the decision about where the academic programming should go and what was in the best interests of the citizens of the state. And so that's what I saw lacking in this, was a mechanism to take these various forces, all of which we can honor what they are wanting to accomplish, but they weren't generated out of the SUS system. They were generated out of entities with perhaps very differing views on where the system should go strategically. So I think what I'm certainly looking for is a mechanism for decision making that can weigh some of the values of these partnerships along with respecting the local university, that's part of their responsibility for the state.
Dr. Genshaw?
I just wanted to reiterate some of MJ's comments. The relationship that we used to have with St. Pete College with their graduate entity is they would come to USF and ask, we had the right of first refusal. Do you want to offer a master's degree in dental hygiene, for example? And I'd say, no, that's not our area, go ahead. And then they would ask different universities around the state or out of state to offer that program. That doesn't happen anymore. That doesn't happen anymore. So now we have a lot of community college / state college presidents doing exactly as MJ was saying, inviting anybody they want without regard of who is in the area.
So, Mike, who is on the strategic planning committee, please? Right.
And Colson, Frost, Hosseini, Perez, and Yost.
So it's Governor Martin and Governor Rude, Yost, Perez, Frost, Hosseini, and Colson. Okay. At the start of our conversation, I indicated that I'd spoken with the chairs of the committee before they left on yesterday. They indicated that they had been in several conversations with the universities, and they were very much interested in continuing those conversations to try to operate as a task force that Governor Perez had suggested that we move forward with. So we were kind of moving in that direction anyway. So I guess the first thing I'd like to note is that if we want to call it a task force, we can, but the Strategic Planning Committee has agreed to tackle this issue in conjunction with representatives of the universities. So just know that Governor Perez and Governor Martin and Governor Rude are committed to that, and they made that commitment on yesterday. The decision that the Strategic Planning Committee must make today is whether or not it would like to move forward with noticing the regulation in its current format so that we can get the process started. And there are different theories as to whether that's a good idea or not a good idea. I'm more inclined to notice it because I think it starts the conversation with where we are and moving forward. However, I understand different comments as folks may feel that because it's going to look so different at the end of the day, they're not sure if that makes sense. What I like about the fact of noticing it is that in addition to the conversations that we'll have with the folks who are part of the task force or part of the Strategic Planning Committee, that there are public entities or public individuals who want to make comments as well. It gives them an opportunity to weigh in via whatever process we have in place, so that way if someone else wants to comment on it in addition to the committee, at least there's a way to do that. So I'd like to entertain a motion or thoughts, if no one is ready to make a motion, as to whether or not we would like to go ahead and notice notice the regulations at this point, with the understanding that the Strategic Planning Committee is going to work with representatives from the university to come up with a resolution and a final draft that makes sense. Yes.
You said it yourself, if this is going to be so different than what we have, Don't you think that noticing it will give a wrong signal of we're trying to push it down doing this? I mean, do you we have a meeting in September, and between now and September, we can come up with a plan, and then in September, notice it.
I guess my thoughts, and this is, one person's thought on this issue, is that it does make sense to notice it because, one, it is an issue that we've already seen that the public has a great interest in and would like to weigh in and provide comment. And if we haven't noticed, it provides a real avenue for that to happen. The second thing is that things tend to get bogged up in the process. And if we don't put things in place to move things forward in a lot of instances, things just kind of get lost somewhere, and all of a sudden it's September again. So the reason I'm inclined to suggest that, and I think that we've had a lot of comment around it, so it's not like anybody, it seems that the question is whether what's written just matches what we think we should do. And we're not so far apart, it seems, as far as the concepts. It's just maybe the language needs to be drafted or changed, but at least we have a starting point. So that's my thought. Governor Yost?
It seems to me that what the comments do typically is the comments come back and talk about the language and the specifics. And it seems to me that what we end up with may be so different than what we have now. I think it's counterproductive at this point to notice this and get comments back on specifics that we at this point think we may agree conceptually where we want to go. I think the text is going to be very different. So I would delay noticing it until we've got something that we're happier with to move forward with. I think it's a mistake to notice it now. I think we'll get distracted by comments that won't lead us towards where we want to go.
So the message is that you don't want to notice it?
So if it comes September and we still haven't figured it out, can we continue it if we notice it?
Yes. Yes, you can still continue. It's just that...
So what you're saying is so I understand, I'm new at this. So if we notice it, all we are trying to do is we're not trying to force something. All we're trying to do is bring other stakeholders to the table. Am I correct?
That's what it does. I mean, yes.
That's what it does. Okay, I'll make that motion.
Could I talk process just for 1 second? The standard process is exactly the same for this as we use for every regulation. We get ready to promulgate a regulation. We craft something with lots of input from a lot of people, put it in front of the board as an item, and ask for the ability to post it, knowing that that actually begins a process of review, public hearing, the opportunity for people to weigh in. Now, we try to get the thing before it is in this form with lots of input into a form that's reasonably what people seem to want, whether it's members of the board, whether it's members of the university community, whatever it is, and bring that forward. That only begins a process of promulgation. And I think President Machen said it, this thing may end up very differently. So it may not come back in the typical timeline that it usually would if we got no public input and everybody was satisfied with it. But it does not bind the board to anything prior to final approval, whenever that ends up being.
Yeah, I make a motion to notice it.
I will second. If I may have a comment. I have, I think Governor Beard's outline of where we ought to go with this regulation is right on point. And I'm, one of the things I'm concerned about is the undergraduate aspect of this. And I think the internet is open for everybody. I think these graduate programs are going to be hard to control. But I think we have, the undergraduate aspect of this we need to really focus on. And as tuition rises, these students become very valuable to these universities. And there's going to be a lot of competition amongst the universities for the students. And we need to provide some guidance in that. I think your outline, Governor Beard, was, I think, on point. So I'm for getting this done sooner rather than later, so I will second the motion only to get this, because maybe we can come out in September with something that everybody's agreeing with and we can get it approved. If we can't, we'll renotice it again and no harm's done. So I'm seconding.
Governor Perez?
I would typically support noticing as well. The only question that I have, and Madam Chair, you can deal with the response, is I think what we have in front of us is markedly different from what we're going to finish with. And unfortunately, I think this is a very passionate issue for a lot of folks and a lot of alumni. And I just want to make sure that if we do decide to go forward and notice this, and I will defer to the chair on this, but I think we may be starting media conversations and raising a lot of emotion when it's just read and not understood the theme under which we're operating, that we're going to create a lot of angst and dialogue that we could probably be spared if we went through a different process. But again, I will defer to the chair on whether or not you wish to notice.
And I guess my response to that is that you're probably right. I mean, it's already created angst and a lot of concern from a lot of folks. But the idea is that the only way that we channel that and really have a way to have those players weigh in, some of them that you and I may not even think of, is because it is noticed and they can weigh in that regard. Whereas if we don't notice it, there really is no real legitimate process for a party who I may not have normally thought of would be an interested party to weigh in and say, this is why this is important to my community.
Let me, if I could just ask, because what I was hearing from Governor Colson, and I have to agree with him, it sounds like there's going to be a focus on the online courses in this situation. I think we're broadening the scope of what we're talking about. We're at least going to deal with them in one way or another. So I think the ultimate regulation, whatever we adopt, again, will include things other than this. And I'm wondering if Vicki can confirm President Manchin's comment that if we change it markedly, do we have to renotice and start the process again? Or can we come through a task force having noticed this, make wholesale changes and just adopt it? And is that what we would want to do?
Go ahead and answer. I think I know the answer, but go ahead, Vicki.
Yes, Governor Perez. If we substantially modify this regulation, it would need to be noticed for public comment again.
So, I mean, if that's the case, then
Yeah.
we ought to not to notice it.
I guess here's my only issue with this, and really I'm not like, my heels are not in the sand on this, and this is more speaking for the chairs of the committee. If the committee, because this is a committee vote, and if the committee, I'm looking around to the folks that Mikey called out, do y'all think that the committee is going to move forward with the issue, that you're going to find ways to kind of get everyone's input, and that at the end of the day it's going to make more sense to have a regulation that you can notice in September, then I'll tell the committee chairs chair and vice chair, that's what the committee prefer to do, but that the committee is asking that they move forward. I just think that if at the end of the day in September we're going to notice it as something different anyway, then aren't we on the same timeline? And doesn't it just seem to go ahead and make sense that at least you have an avenue for the public to weigh in at this point? So that way, when you get to September, even if you change it and have to notice it again, you've got at least given an opportunity for everybody to weigh in on it. Governor Tripp.
Madam Chair, you have not asked this board to do a lot of things on your behalf. I understand how you feel on this. I asked the board to look to your leadership, and let's do it the way you'd like to do it because you've been a good chairwoman.
Of course, I wouldn't ask it that way, but I just think that I will let, I tell you what, there's a motion on the floor, and thank you very much, Governor Tripp, for saying that. There is a motion that's on the floor. Keep in mind, I'm filling in for Governor Martin. And I'm just expressing the views of Governor Martin and Governor Root. I just happen to agree with them, but I'm expressing their views. So at this point, unless there's any other discussion, Governor Perez?
Just one more. If what, I'm not saying if what Vicki says is right, because I'm confident that Vicki said it was right, but that was for you, Vicki. But since my concern was if we noticed this, changed it substantially, and didn't have to renotice it, we wouldn't get the input on the myriad changes which may come. If we change it substantially and we have to renotice it again, and there'll be opportunity for public comment and input, I don't have any aversion to noticing this, Madam Chair.
By the way, if I can, one last comment. we're anticipating wholesale changes to this. Guys, I'm telling you, when you get into this, and I've spent time on this with the Strategic Planning Committee, the what-if questions start to be asked. It's always easy to think you can handle something with a general and vague statement that allows people just to figure it out. I'm telling you, we're looking at this for the next 20 years, and the possibilities are endless. Now, I'm not saying you can ever create a regulation that is so verbose that it will take into consideration every possible potential. But at the end of the day, you've got to end up with something that deals with, somebody said it, the myriad issues that you're going to face with a mass movement around the state, which at the end of the day is hopefully a very good thing for the state, but also has to consider the potential challenges that may be faced. So I'm not sure how much change, although everybody should be wide open to it. That's the process of promulgating a regulation. We do it every time. But I'm not sure that to assume that there's just going to be wholesale changes at the end of the day is safe.
Yes.
I hope you do.
The motion on the floor is to notice the regulation, the regulations as described by Richard and Nancy, and the ones we've had several conversations on and noted in the agenda for strategic planning. All those in favor signify by saying aye.
Aye.
All those opposed? Right. So at this point, note that, Dr. Yost was next, that the Strategic Planning Committee has voted to notice those regulations. Thank you all very much.
Madam Chair, will you appoint that task force, or will Governor Martin appoint it?
The way that the task force, and thank you very much for identifying that so the record is clear. What I would like to do, and Governor Perez, let me ask you a couple of questions about it. I guess my intent was to have the Strategic Planning Committee to function as that task force. And I think that I want to get your thoughts on, you think we need to specifically identify representatives from the system to participate with us as well? Do you think that worked better for you when you did that?
Absolutely, Madam Chair. And we had representatives from the larger universities and the smaller universities. Several of our provosts were involved. They were incredibly helpful and participatory. And I think it will be a benefit to bring representatives from each of the large, not each of them, but certainly representatives from the larger and smaller universities so that we can get full input. I got to say it was incredibly helpful to the task force I ran.
So what I'll do is between now and before we conclude our session today, I'll appoint the representatives from the universities to also participate with the Strategic Planning Committee to act as a task force to address the issue. Yes, sir.
I mean, we have 7 people in our committee. We don't need to have all 7 to be involved with the
Okay.
task force. Maybe
Okay.
you want to take 3 or 4, and then because then that makes it a good group.
Okay. So what I'll do is I'll assess the members of the committee. I'll look across the system, and before we conclude our deliberations or meetings today, I'll appoint that task force to address the regulation issue.
Thank you, Madam Chair.
Governor,
Yes.
could we ask that as a matter of courtesy while this issue is being discussed that the presidents notify a president if they're thinking of moving into their traditional service area with a new program?
Okay. I'm looking across. I mean, that sounds reasonable. I'm asking you guys if and keep in mind we've noticed that we're hoping to move on this relatively quickly. The request was whether, as a matter of courtesy, we can have our presidents to at least notify each other if we're planning to move forward with issues that may, that may be impacted by these proposed regulations. Is there any objection to that? Is a better way for me to address it? And keeping in mind, we're going to try to move as quickly as we can so we're straight. So, seeing no objection, Dr. Saunders, I'm going to assume that it's understood that if any of the presidents intend to move into areas or I guess be involved in programs that are impacted by these proposed regulations, that they'll at least notify some the other institutions. Okay.
FYI.
I'm looking around at everyone to make sure we're on the same page.
And no one's meeting eyes.
And no one is looking, so is that suggesting that we're not on the same page? And you guys didn't want to notice this? Okay.
That speaks volumes.
Yeah.
Perhaps you could see the dilemma here.
And I guess, is that a problem, is my question.
Bad oil painting of the Last Supper down there.
Okay, so it's understood that until we can deal with these issues, that the presidents will talk to each other as a matter of courtesy if they're going to move forward with programs that are new that will be impacted by the regulations that we're considering. Okay. And I guess that if that's going to be a problem between the regulations, it'll come back to the Board of Governors and we'll look at it until we figure out the exact process. Okay. I wish I could take a snapshot of this one right now.
I'm with Maury. There's too many on the task force. I'm off.
Right. The next item on the agenda.
Wow.
God. Tell you what, I'm going to go to item
Okay.
item 3
Chair-
on the agenda. I'm sorry, Dr. Ginshaw.
I'm sorry to interrupt, but we do have a county commissioner that would just like to welcome the group.
Oh, sure. That's
Okay.
fine.
You'll be
Oh,
thrilled.
Mark, I didn't know you were here. I was going to go on.
Welcome.
Well, it's an honor to be here. My name is Mark Sharp. I'm a county commissioner from Hillsborough County. It's great to see Chancellor Brogan and so many others that I've had the opportunity throughout the years to know. Just want to say that we're honored that you're here in Hillsborough County. And we recognize, there was an old adage that what was good for General Motors is good for the country. We know that what's great for our university system is great for our state, great for our economy. USF has been integral to the economy and the economic development of Hillsborough County and Tampa. And we are absolutely committed to working with USF to help drive our economy. So we just are honored that you're here, looking forward to hearing what you're going to do, and we know that you're going to help make our state that much better. And just again, thank you, Dr. Ginshaw, for giving me the opportunity to be here, and thank you for all of your great work.
Thank you.
No, thank you so much. Dr. Ginshaw, I think he may have heard me say thank you as he was leaving the room, but please let him know how much we appreciate the fact that he would come and greet us, that we appreciate the hospitality extended by Hillsborough County, by us having our meetings here. So thank you very much for having him to come in. I apologize. And please know, I was just trying to work through some logistics of our agenda because we are pushing against time. And I'm sorry, Micah, you were trying to give me a message? Okay, I'm going to try to push through as much as I can. I think that what I'd like to do is to let's take a minute and go to item number 3, which is dentistry and dental education. I know.
This is just a report.
So my thoughts are that, we are going to complete the strategic planning agenda. I just thought it maybe be better to go ahead and address this issue. And then the other item that I did skip over, we will go back to that item because we need to kind of get the thoughts again of the committee on how we're going to proceed with the expansion issues that we know are facing us like right away. As you are probably aware, interest has been expressed by more than one state university system institution to create a new dental school. In addition, our existing dental school at the University of Florida wishes to expand its enrollment. You have as backup to this agenda item a white paper that staff provided to us earlier this year, which attempts to contextualize dental education, in the current status of Florida's provision of dental services. Today, the committee will hear brief presentations by staff, by representation from the Florida Department of Health, and by the dean of our existing dental school. Members, I'm going to suggest that we wait with questions until we have heard from all 3 presenters. And our first presenter is Associate Vice Chancellor Dr. Ari Lamont. And basically, Dr. Lamont authored the white paper that was presented by staff on behalf of the status of dental education or the status of dentistry in the state of Florida. So, Dr. Lamont.
Thank you, Madam Chair, for the opportunity to spend just a very few minutes briefing you on the important subject of dental education and dental health care. A year and a half ago, when he was informed of multiple interests in starting new or expanding existing colleges of dentistry, the Chancellor began meeting with a number of offices at the highest levels. In addition, staff have spent over 1,000 hours in meetings and analyzing relevant reports, studies, and other materials, we have come to agree with the United States Surgeon General, who wrote that the nation has a serious challenge providing dental care, and we believe that Florida is at the forefront of this national problem. My presentation will focus on information from 3 separate reports that converge on this subject and whose findings support one another. First is a Board of Governors white paper provided to you in March of this year and provided as backup to this agenda item. Second is the Florida Department of Health's first annual dental workforce survey, also published in March 2011, and which provides a wealth of data with regard to Florida's current and future dental workforce. A synopsis of this report was provided to you earlier. Third is the Florida Department of Health report published in 2009, which contains key recommendations for meeting Florida's dental health care challenges in an immediate, cost-effective manner. There are a total of 56 colleges of dentistry in the United States, 37 public and 19 private. To state the very obvious, dental schools produce dentists. While it is true that some dental schools also conduct research, it is typically not of the magnitude of a medical school. The University of Florida College of Dentistry is atypical in that regard, but it has taken UF 40 years to reach its current level of research prominence as number 5 in the nation. Because producing dentists is what dental schools do, discussions surrounding new or expanded dental schools should be based on evidence of a workforce shortage or a workforce anomaly that can be solved best or solved only by creating new dental schools. This is especially true because of the cost of dental schools, so allow me to say just a word about that. What you are looking at on this slide is a typical dental school simulation laboratory, and if you think it looks expensive, that's because it is. According to the American Dental Association, the average dental school spent $93,000 per student in 2007. Just doing the math, it is easy to see how dental school budgets can begin to approach the magnitude of $40 million. This is borne out by the Lake Erie College of Medicine's plan to open a new dental school in Bradenton, Florida in 2012, in which $52 million will be invested. In fact, the University of Florida Dental School has a $60 million budget, approximately 1/3 of which comes from its research portfolio, and only another 1/3 of which is provided by the state. Now, let's turn to an examination of Florida's dental workforce to look for evidence of workforce shortages or anomalies. First, let's look at the basic numbers. Florida has just over 11,000 licensed dentists. On average, every Floridian sees a dentist 1.3 times a year. Florida ranks 4th nationally in the number of dentists and is at the national average in number of dentists per capita. This Department of Health chart demonstrates that 78% of Florida's dentists, the green, the gold, and the teal, are between the ages of 20 and 59. This Department of Health chart demonstrates that at least 74% of Florida's dentists are in general practice with a lesser mix of dental specialties. This Department of Health chart demonstrates that almost 100% of Florida's practicing dental specialists are accepting new patients irrespective of specialty. This is characterized by the Department of Health Workforce Survey as a source of unused capacity. This slide and the next focus on dental productivity in terms of time spent working. This Department of Health chart demonstrates that 92% of Florida's dentists practice 11 to 12 months per year. This Department of Health chart demonstrates that 78% of Florida's dentists, the green and blue slices of the pie, are practicing from 31 to more than 40 hours per week. This Department of Health chart demonstrates that 96% of Florida's dentists, the green, the gold, the teal, and the orange, see from 26 to over 100 patients per week. Here, we see that 19% of Florida's licensed dentists, the green piece of the pie, are not practicing in Florida. Normally, this might be a cause for concern, but thanks to the Florida Department of Health survey, we know that, in fact, it represents a future capacity of dentists coming to Florida. The greatest portion, 75% of that green piece of pie, is comprised of dentists who intend to come to Florida, And even more good news is that the population in the green slice between the ages of 20 to 29 is the group with the most immediate time frame for coming to practice in Florida. What about impending retirements? Here, the blue line of this Department of Health graph indicates retirements from the workforce, and the green line indicates additions to the workforce over time. The Department of Health projection is that new dentists entering Florida's workforce far outpace retirements at the rate of an estimated 3,000 additional dentists per decade. To recap, Florida's dental workforce approaches the national average per capita and is number 4 in the nation in basic numbers, has unused capacity, has a relatively young, hardworking general dentistry workforce, and projections for future dentists in Florida significantly outpace expectations of retirements. Moreover, the projected growth of Florida's dental workforce does not take into account the planned Lake Erie College of Medicine School of Dentistry, which will open in 2012 and is projected to graduate 100 additional dentists per year. What the data do point to, though, is an underrepresentation of both Hispanics and especially African Americans in the dental workforce. I began this presentation by indicating that Florida has a major dental care challenge. Here, I want to provide a conceptual metaphor for the nature of the problem. If Florida's challenge was linear in nature, it would be like a chain in which a missing link, such as simply producing more dentists, could be inserted to address the problem. However, the problem is metaphorically much more like a Mobius, the elements of which perpetuate one another. And the components of the challenge are these: the status of Medicaid, Florida's geographical distribution of dentists, and its current status of serving the underserved. In this conceptual model, the most critical question becomes, how can Florida provide dental services to the most needy in the context of Medicaid and geographical access challenges? This map portrays dentist to Florida citizen ratios by county. The lighter the color, the better the ratio of dentists to residents. You will note that Southeast Florida has the most favorable ratios, while counties elsewhere have the least favorable ratios. This is a pattern true irrespective of dental specialty. There are from few to virtually no dentists residing in certain primarily rural areas of Florida. This phenomena, clearly captured by the Florida Department of Health's Dental Workforce Survey, is articulated as a national dilemma by the American Dental Association. Dentist workforce size is not a problem. The real problem is where the dentists are in relation to underserved population. Almost 1/3 of Florida's dentists reside in 2 of its 67 counties. Having said that, it is also true that in Florida, the underserved are not being served irrespective of where they live, not because of a dental shortage, but for other reasons. Florida has one of the poorest track records in the United States with regard to providing dental care to the underserved, according to the 2010 Pew Center report, which gave Florida an F, ranking it 49th out of 50 states for providing dental care to Medicaid-eligible children. The 2011 Pew Center report, issued just days ago, makes Florida one of only 3 states to receive an F for a second consecutive year. That same report indicated that Florida needs 800 dentists to address its federally designated shortage areas. The point to understand, however, is that Florida currently has those dentists in its aggregate workforce, but they are not providing services to the underserved in either rural or urban settings. This Department of Health chart captures the very minimal number of dentists who are practicing in settings where they are most likely to see socioeconomically challenged patients. They include community, county, and federal health centers, correctional facilities, veteran and military facility clinics, and universities. In total, dentists in these sites account for only 5% of the dental workforce. The next few slides of this presentation will focus then on why dentists are not living and practicing in geographical areas of underserved need and or do not provide services to the underserved irrespective of where they reside. Florida's dentists are not providing Medicaid services to the rural and urban underserved because Medicaid dental reimbursement rates and services in Florida are the lowest in the country for children and especially for adults. This leads to a perilous stair-step downward. Florida has approximately 11,000 dentists. Of those, only approximately 1,500 are enrolled Medicaid providers, and of the 1,500, only approximately 1,200 actually provide Medicaid services. 21 of Florida's 67 counties have no Medicaid providers. Another way of looking at it is like this. If from among the 8,500 dentists who currently do not see Medicaid patients, Florida could entice just 7% to become Medicaid providers, it would provide the 800 dentists required to erase Florida's federally designated shortage areas. According to the Department of Health survey, by far the reason for not accepting Medicaid patients centers on the low reimbursement rates. This is represented by the next to last bar on this Department of Health chart. The two bars above that bar indicate dissatisfaction with billing requirements and the amount of paperwork involved in seeking Medicaid reimbursement. My last slide. In its 2009 Department of Health Oral Health Care Report, new dental schools were ranked 50th out of 50 strategies for addressing Florida's most pressing dental health care needs. Reasons cited included the shortage of dental faculty, the debt accrued by dental students, $154,000 on average at the University of Florida, which correlates to a disinclination to accept Medicaid patients, and the absence of a loan forgiveness program to entice dental school graduates to practice in underserved areas. There are, however, other more immediate options recommended by the Department of Health for addressing dental care to the underserved in Florida. These include solving Medicaid challenges. In the absence of positive Medicaid reform, prospects for other strategies are diminished. Revising Florida's dental licensure process so that dentists in other states can come to practice in Florida without having to retake examinations. Creating undergraduate feeder programs into existing programs. Providing incentive programs for practicing dentists, and providing loan forgiveness programs as incentives for dental students. Madam Chairman, that concludes my presentation. I'll be happy to pass the podium on to the next speaker now.
Thank you, Dr. Lamond. With that, we're going to go forward with the next presenter, and that's Amy Colbert. She was the Assistant Division Director of the Florida Department of Health. And thank you very much for coming, Ms. Colbert.
It's an honor to be here. I have to say it's extremely rewarding to see our work being used to help with this process that you go through with your Board of Governors, and rewarding to see that it's being used in that way. The Department of Health is heavily vested in oral health workforce. Not only does the agency license all dental professions, but we are heavily engaged in the safety net itself. We actually provide clinical services in 53 of our 67 counties directly. We also contract with entities to provide services in several other counties as well. We employ clinical dentists, 194 dentists in our facilities, and you can see a large number of auxiliary staff as well providing direct services. And we are, as I said, we have a large scope of clinical practice. Just some brief statistics on the services that we do provide in the state. We do average 2.2 visits per patient and 3.8 procedures per visit. Many times safety net providers are misunderstood or misperceived. There's misconceptions that perhaps they aren't doing the complex procedures or they aren't doing the treatment and the diagnosis, but rather primarily preventive activities, but that is not the case. RVUs are relative value units, and those speak to the complexity of the work that's being done in our county health departments. The uniqueness of our patients is that we are primarily serving the Medicaid population. You can see that almost 70% of our patients were Medicaid, and the majority of those were children. We do provide over $50 million in Medicaid services annually to Florida's Medicaid population. There are some large consensus on what it takes to improve oral health. The significance of this slide here is to show you that with the exception of community water fluoridation and personal responsibility, taking care of your own teeth, every other element of improving oral health relies on workforce. and having an available and adequate and competent workforce available. Unfortunately, it's not just a one-size solution. There's just not one answer. It's a complex, as Dr. Lamont referred to, it's a complex issue. And just for example, we have disparities in many areas. There are documented disparities in access to care for many minority populations in Florida. And of course, the strategy there is obviously to recruit and establish more minority providers in our state. Another example would be special needs. These are persons that perhaps need special services, either anesthesia or sedation, or particular case management that goes beyond the skills or comfort level of your average general dentist. This would require additional training, and the comfort level is kind of, isn't speaking to the patient's comfort level here, but to the provider being comfortable treating this type of population. So just to say that the disparities are great and the strategies must be diverse. Just to mention one other item here on the bottom of the page, you talk about utilizing physicians. We've been very successful in Florida. We partnered with the University of Florida College of Dentistry and approached Medicaid about getting reimbursement for physicians, A&Ps, and PAs to provide dental services for children up to 3 years of age. We have, since we initiated that program in 3 years, we have 63 unduplicated clients having received over 98,000 services and 648 providers currently participating in that program. So that's an alternative solution to some of the issues. The department has been engaged in workforce discussions. We have been a convener, bringing together stakeholders from across the state. I do at this time need to make a disclaimer. These committees and these reports were published convened in 2008 and published in 2009 and 2010. They predate our current governor and our current state surgeon general. My presentation of them here today in no way implies their endorsement of any of the recommendations or policies therein. That being said, the state surgeon general at the time, Dr. Enavia Monte-Ross, in 2008 convened a health practitioner oral health care workforce ad hoc advisory committee, which provided recommendations on workforce to the governor's office. We followed that up with a second workforce group we funded through a HRSA grant and continue ongoing work. The ad hoc group, 19 members representing academia, state agencies, professional associations. They had 5 conference call and a face-to-face meeting. And of course they were meeting under the sunshine. They made some general observations that education and prevention were really essential and the key to meeting the oral health needs of Floridians. They were consistently in consensus that access issues definitely exist here in Florida for certain populations. They felt that safety net providers are essential to the solution and we needed to perhaps explore new models there. They had concerns that we needed to perhaps address additional training in some areas, and it could be valuable in addressing the issues of access to care. Trying to use general dentists more frequently to enhancing their skills so that we don't always need a specialist. There's many times where, for example, children don't always need to see a pedodontist. They can see a general dentist and get services, but many general dentists are not comfortable treating children, especially very young children under the age of 6. Dr. Lamont referred to the strategies. We did rank them for impact and feasibility. The top 20 for impact were heavily discussed, and the end result were 11 recommendations in 5 categories. The first is public education and prevention, and that is community-based as well as school-based. These are things like community water fluoridation, expansion, school-based sealant initiatives, school-based fluoride rinse initiatives, tobacco education, incorporation of dental health into overall health, and even talked about school lunch and access to sugar snacks during the school day through vending machines. Training providers. I'm sorry, I seem to have lost my... out of order. Here they looked at dental school external residencies. Currently we have a few of those with our county health departments. The rotations are short, only 2 weeks, and contrary to some expectation, this doesn't increase capacity of these organizations or operations to see additional patients. And the recommendations were that these rotations needed to be more significant in length, 3 to 6 months, to have any meaningful opportunity to impact the need. They thought it's especially important to expose them to children's dentistry and special health care needs. In conversations with Dean Dolan, she did share that less than or equal to or less than 5% of the dental education experience is pediatric in nature, whereas in the safety net situation, what our current population or caseload is primarily 91% children. Establishing short-term training programs, not only in pediatric dentistry, but also in special needs dentistry and geriatric dentistry, allowing general dentists to get some additional training and some new skill sets and greater confidence in working with these populations. The next area they looked at was legal policy, and here it primarily revolves around practice acts, expanding duties and scope of practice and supervision levels for those allied or auxiliary providers such as dental hygienists and dental assistants that do provide the services under the supervision of a dentist. They were very specific in their recommendations here, and I'm not going to share those with you because they're very practice-oriented, but most of them revolved around expanding what the hygienist and the dental assistant could do in a health access setting. That was defined in legislation a couple of years ago when we were working on the ad hoc committee. Those are basically corrections facilities, county health departments, community health centers, schools, etc. And the groundwork that we laid here has been successful. House Bill 1319 did pass this year, and that does allow for some expansion of what hygienists can do in health access settings. So this is one, of course, the strategies that's highlighted in the Pew report. Seems to be a missing slide on third-party payer issues, or else I skipped it, so let me just go real quick. Medicaid administrative burdens, Dr. Lamont shared with you a slide that we got some data. On that issue, these were recommendations for simplifying the process, in improving the time period for getting reimbursement, which is also an issue, increased rates. Other states' experience have shown that increasing rates alone does not necessarily always result in a positive increase in access to care. They found that there had to be in collaboration with other reforms. There's also opportunity to reduce Medicaid administrative burden for the patient as well, making sure that you have culturally linguistic competent and health literacy available in this delivery of services, extending hours of services, providing transportation, case management, etc. The recruitment and incentives to attract providers to safety net positions such as those in county health departments and community health centers. It's traditionally very difficult to recruit into these positions. Some suggestions were to try to improve wages, working conditions, decrease paperwork, utilize improved equipment and technology. A key recommendation was to fund the Florida's Health Service Corps, which allows for loan forgiveness, which is currently on the statutes but unfunded in Florida, and also to market the I'm sorry, that disappeared in the National Health Service Corps program. Strengthening local, regional, and statewide volunteer workforces. There are some issues around sovereign immunity. There's a desire to provide incentives through tax credits or perhaps to decrease licensure fees, and then providing finally, providing technical assistance to communities who want to recruit dental providers through the construction and equipping of a dental practice in exchange for provision of dental services for this community. As you've heard, startup costs are astronomical. Let's see. The second series of workforce meetings included a broader membership of stakeholders. We brought in health professional recruitment professionals, the Florida Public Health Institute, county health department level staff, and state dental program staff. In the first group, the department staff staffed the meetings and helped, staff the committee, but did not participate in the discussion or the dialogue. And so in the second group, we expanded it so that those persons could contribute and be a part, because they're a large part of the safety net that's currently out there. The unique thing about this HRSA workforce report is it does include a strategic plan. Some of the things, they broke theirs into 8 goals. I just wanted to highlight a couple of the things that they brought that were new or beyond what the first group. But keeping in mind that many, about I'd say 2/3 of the original group transitioned into the second group and continued. This second workforce group actually had 4 all-day face-to-face meetings and 9 conference calls in 9 months, and really ironed out some very contentious issues among different types of providers. In the first goal, they talk about education prevention. The new thing there was really focusing on messaging, and in fact, we recently at the department have launched a web automated human interaction. It's called FloridaMouthwise.com, where it targets different populations, and it's a social media type of educational piece. Both traditional and non-traditional messaging was seen as an opportunity to address this goal. Data collection is a huge one. The workforce survey was the first thing we tackled, and just to clarify, that is a biennial survey, not an annual survey, because licensure for dental professionals is a biennial process. Statewide needs assessment, we did complete that, but recommendation to continue to have those done. Oral health surveillance system, you'll see if you read the Pew study, that's something that Florida does not have and does not report data into the NOHSS, the National Oral Health Surveillance System. Targeted surveys with at-risk populations, with recruitment and retention surveys with providers, surveys with clients who use Medicaid and Kid Care, find out what their barriers are for utilization and their perceptions. They worked on a lot of the same issues, but really in greater depth, and actually came up with some rule changes and some legislation that has been, some has moved forward. Integrating oral health education into general health and medical programs is a huge opportunity. I mentioned the Early Childhood Caries Project that uses medical providers to provide care. It's a very logical approach as medical providers see children from 0 to 3 on a very regular basis for preventive health care. And in fact, we do have Florida State University family practice residents rotating through one of our health department clinics presently. Partnerships with Head Start, WIC, programs that engage parents and children, school health, also doing work with nursing homes, long-term care facilities, and promoting dental homes were identified as strategies to improve the situation. Training opportunities, we talked about some of those before, but they also added to the mix anesthesia and sedation training. Many of those in the safety net provider level don't have the training or the comfort level working with anesthesia and sedation, and therefore are not able to accept some patients who need those services. Improving the state oral health infrastructure, that would include staffing, dollars, and visibility of the state dental program, an expansion of the safety net, expansion use of mobile things, vans, centers of excellence, new technology, and continued dialogue on the workforce issues. Increasing recruitment of practitioners to serve these populations. They really focused heavily on minority recruitment, marketing the health access license, which allows for dentists, this past, about 2.5 years ago, allows for dentists who work in health access settings to not have to retake the clinical portion of the boards to practice dentistry in Florida. Talked about a PGY 1 year. This is where a postgraduate year where they actually provide services in underserved areas before they're able to get a Florida license. Talked about local and state dental referral networks, and quick synopsis of everything they talked about. You heard about the Pew Center. Between the first and second year, there were 22 states that improved their grades. These are states that were able in this difficult budgetary times to implement policies that impacted children's dental health. Of course, the whole impetus behind the Pew's work here is to stimulate discussion and action on addressing the unmet needs of children's dental health. And that's it. At this time, I'll turn it over to the next speaker. Thank you.
Dr. Dolan?
Well, thank you and good morning.
Good morning.
I realize I'm probably the only thing standing between you and lunch, so I'll try to be comprehensive but quick. I also want to pass on my compliments to Dr. Lamont. If he was enrolled in one of my dental health policy classes, I'd give him an A+. He did invest a lot of time understanding dental health education issues and summarize them very completely and accurately in his report to you. So I hope that's very informative to you in your decision making. To tell you a little bit about myself, I had the pleasure of serving on the faculty of the University of Florida College of Dentistry since 1989, and I've served as dean since 2002, and I'm very proud that our college is considered one of the best in the United States. Our college is ranked 5th of the 61 dental schools in our research ranking, and we have consistently high performance on national board and state licensure exams, and our college consistently demonstrates excellence among its peer institutions nationally and is an academic leader on the UF campus. My goal today is to share background information about the history and current status of the college and to review state and national trends in dental education. But we have a very limited amount of time, so I'll also offer my assistance to you beyond what we can discuss here today and to invite you to visit our college and our campus to get a first-hand look at a College of Dentistry in operation if that's of interest to you. I know many of you have been to the University of Florida campus. This is an aerial view of our campus, and the smaller circle indicates the Health Science Center. And what's really important to me is that our Health Science Center and our College of Dentistry are also co-located on the main campus. And I would say that this is a major strength of our College of Dentistry. And this is an aerial view of our Health Science Center. Just as the UF campus has grown and matured over the years, so has our college. And this is a really brief, quick history of dental education in Florida. From 1949 through 79, Florida supported dental education through a regional contract or compact, and 1,275 Florida dentists were educated under this arrangement. In 1957, the Florida legislature authorized the addition of the College of Dentistry to the Health Science Center at the University of Florida. However, funds were not appropriated until 1968, when $20 million was appropriated from the National Institutes of Health, so that's federal resources, and $13 million from the state of Florida. And I should emphasize that the $13 million appropriated in 1968 is the one and only significant state capital investment in dental education in Florida's history. And as a result, UF's Dental Science Building is almost 40 years old and has serious design and infrastructural problems. UF remained the only dental school in Florida until 1997, when Nova Southeastern University enrolled its charter class. And as you know, LECOM, a private institution, is intending to enroll its charter class in 2012. So as illustrated in this timeline, the number of professionally active dentists in Florida has grown substantially over the years and mirrors the increase in Florida's population. And so some of you, if you're not too hungry, may be asking, are there enough dentists in Florida? And some of our previous speakers have addressed that, but to briefly recap, Florida is currently ranked about the middle of the 50 states in terms of professionally active dentists per capita, and we approximate the national average of professionally active dentists per 1,000 population. And with the addition of LECOM, we'll graduate approximately 280 dentists per year in the year 2016, and this number would be higher if the University of Florida increased its enrollment or if additional dental schools were approved. The increase in dental education enrollment mirrors that in the United States, and this is an illustration of that enrollment, historical trends. Enrollment grew dramatically during the 1960s and early 70s. To meet the dental care needs of the country's growing population, the federal government invested and mandated an expansion of dental education. 14 new dental schools were constructed, and almost all existing dental schools were either expanded or renovated. And the UF College of Dentistry construction was one of those 14 dental schools initiated during this time period. By the mid-1970s, federal investment for dental education significantly decreased, and the responsibility of public education financing shifted to the states. And as you know, most states began having financial difficulties in the early 1990s, which further stressed revenues for public dental education. And during this time, 7 dental schools closed for reasons that included the high cost of dental education and the declining applicant pool. And the declining trend in dental applicants began to reverse itself around the time when Nova Southeastern University admitted its charter class in 1997, and Nova was the first new dental school to open in the United States in 24 years. And since 2002, 6 new dental schools have opened, and at least 8 additional schools are proposed. This slide illustrates the fluctuations in the number of applicants to dental schools over time. You'll note that dental school applicants reached a historical peak in 1975, and then during the economic recession in the late 80s and early 90s, the number of applicants to dental schools dramatically decreased to a point where there were approximately 1.3 applicants nationally for each available dental position. During stronger economic times in 2006 and 2007, for example, there were about 2.4 applicants for every dental position. Thus, applications to dental school are cyclical, and they're related to the economic attractiveness of dentistry as a career and the perceived rate of return on investments for dental education. Another economic factor related to the demand for dental education is educational debt. The average graduating debt of a University of Florida dental student increased from $85,000 in 2004 to $154,000 in our most recent graduating class. All recently opened and proposed dental schools have relatively high tuitions of at least $55,000 per year, and likewise public dental schools have been increasing tuitions between 10 and 15% a year, resulting in increasing graduating debt loads at all schools of dentistry, both public and private. The tuition and fees for the DMD program at the University of Florida for the upcoming year is about $35,000 for Florida residents and more than $61,000 for non-residents. And this tuition approximates our AAU peer public institutions, and about 90% of our enrolled students are Florida residents. This slide illustrates trends in our College of Dentistry operating budget for the previous 10 years. And while our overall operating budget increased from 1999 through 2007 and then flattened and slightly decreased through 2009, the state appropriations, which include tuition, have remained largely flat. So therefore, we rely on other sources of revenue to operate the college, and that includes clinical revenue, contracts and grants, and gifts and endowments. And the college, like many other industries and public entities, has had to make significant changes to its clinic operations, in particular to improve efficiencies and ensure adequate resources to operate our college. This slide shares some programmatic highlights of the University of Florida College of Dentistry. And as you can see on that chart, we have a relatively large full-time faculty. We offer 16 degrees and certificate programs. We generated more than $18 million in research funding and provided more than 120,000 patient visits in fiscal year 2010-11. Our programs are in high demand, and admitted students are among the top pre-dental students in the country. The college has a strong commitment to underserved populations. Last year, our Department of Community Dentistry and Behavioral Science received 5 federal grants totaling more than $7 million over 5 years from HRSA to address issues related to the enrollment of underrepresented minorities or improving access to dental care. You might find this slide of interest in relation to your prior discussions, but through our statewide network for community oral health, the college improves access to dental care for Florida's residents in a variety of locations throughout the state. And we tend to focus on vulnerable and indigent children and adults and special needs patients. So the college owns clinics in St. Petersburg, on the St. Pete College campus, in Hialeah, in Naples, and the Edison College campus, and we work with 10 partner organizations, including Department of Health clinics, where we send students on educational and clinical rotations. The college is also involved in several significant private-public partnerships to improve access to dental care in Florida, and I'll use this one as an example. We recently expanded our collaboration with Collier Health Services, which is a federally qualified community health center in Collier County to better serve low-income children, and through a significant grant and state matching funds, we're able to build a facility on the Edison College campus and initiate a pediatric dentistry residency training program in December of 2008, and through this facility last year delivered more than 10,000 patient visits to low-income children in this community. Diversity is a core value of the University of Florida and the college. You may know that President Manchin has demonstrated this commitment with his fundraising through the Florida Opportunity Scholars Program, and for more than 10 years the college has funded a Summer of Learning program to attract underrepresented minority students to dentistry. And the college currently ranks third in the nation in Hispanic student enrollment. So as I conclude my remarks, and as you consider current and future proposals for new dental schools in Florida, I encourage you to keep in mind the opportunities and frankly the economies of scale presented by the expansion of an existing program. Having said that, the University of Florida has a long history of collaborations both with other state universities, with public and private entities, and we'd be interested in continuing those conversations. And mostly I'd emphasize the importance of master planning as you consider expansion of the dental workforce in your deliberations. So thank you again for the opportunity to provide these comments, and if you have time, I'd be happy to answer any questions you might have. Thank you.
Thank you, Dr. Dolan. Members of the committee, the idea was that we would have the information provided from our presenters to give us the general state of dentistry based upon the studies that have been conducted by our staff as well as by the health department, and then also just the status of dentistry from Dr. Dolan, since the University of Florida's only public dental school. I anticipate that, I guess I first should ask if you guys have any questions about the information that was presented, because the idea is that while they're here, you've seen their presentations. Do you have any questions of any of the presenters that you'd like to present at this time? Sure.
Can I ask you one question? Do you do anything in the Panhandle? That seems to be the area what I noticed. It looks like nothing has really happened there, and if not, why not? Because that seems to be where the need is.
Well, that's a good question, and we have had over the years several attempts to do partnerships in the Panhandle area, and in fact one went through the legislature and was ultimately vetoed. So we've had several, and actually Nova Southeastern had a similar experience. So at some point there was state money appropriated for the development of a clinic in the Crestview area, and ultimately didn't occur. You know, we certainly could consider partnerships to serve that area, and I would agree that that area of Florida is underserved from a dental perspective. It would require some resources to do that.
Thank you. Any other questions? Do you have a question back?
Reports. I mean, thank you for asking them to speak to us. Thank you very much.
So what I anticipate, members of the committee, and basically I'm speaking with the full board, is that if there are universities that are interested in expanding or adding dental programs, that we anticipate that they will submit whatever requests that they have, and that those requests will be considered at our September meeting. And then from there we can make a determination. If we follow our general course, we'd have presentations in September and then have an actual final determination at the next meeting. If you guys would want to change that, we can, and we may not have any. But the assumption is that there will be some presentations or some requests to either start new programs or to expand existing programs that would come to us at some point prior to the September meeting. Governor Duncan, sure. No, please.
I guess, is to entertain proposals the right first step, or is discussing do we need dental schools the right first step before we entertain proposals? I mean, are we kind of going with the presumption of we're looking at them because we need them, or kind of from the strategic planning side of it, should we decide we need them and then decide how to best execute if we do?
I guess my response to your question is that I think whether we need dental, more dentists and how we go about getting there is certainly something that the board has to consider. But I think that it makes sense just based upon where we all know that we are in the process. We've heard a lot about dental schools along the way, that ideally we can have that kind of conversation, but that if there are universities that are interested in submitting proposals, that they should be allowed to make that submission, and then we can make a determination about whether we think there's a need for whatever type of proposal they're submitting. So I would think that it would given that we know that we have an interest, we know that universities have already started investing and putting proposals together, it makes sense for us to at least entertain them. And I'm sure as a part of that discussion, it will be a question of do we really need them based upon the information that's been presented. And those are my thoughts. I mean, if you guys have drastically different thoughts, we can go in a different direction, but I'm thinking that's the best way to not have the issue linger. Let's consider it and, move forward with what we think is best for the state. Any other questions or comments? Great. So again, I want to thank the presenters for the very valuable information. I'm going to ask the Chancellor and the staff to work very closely with any of the 11 that are considering proposals or moving forward, but with the understanding that that we will address this issue for any universities that are going to present applications or requests. We'll address them in September. So with that, I'm going to pause on it. There's one other item for us to discuss on a strategic planning agenda. What I'm proposing is that we stop now. We take a 30-minute lunch. When we come back, we'll finish that one item that I skipped in strategic planning, then go to trustee nominating and go right into the board meeting. We're going to finish up the last item that's remaining in the strategic planning committee. I don't anticipate it'll take a great deal of time. It's item 5, and it's what's next, expanding the system's capacity to help address Florida's access, demands, and economic development goals. I hope that we can really focus our efforts in the next 6 months on determining how we can best expand capacity in the state university system. Under Governor Duncan's leadership, we already have been looking at the role that e-learning might play in this effort. And even in our original strategic plan, we recognize the need to continue to study ways to create the optimum structure for the university system, including number and location of universities, number and location of branches, and number and location of subsystems reflecting the geographic needs of the state. However, we currently do not have in place any specific criteria or policies for determining when or how we will make decisions about developing branch campuses into destination campuses, much less about adding any institutions to the system. So therefore, even as we explore other options to expand access, we need to develop the needed policies and procedures for determining if and when there should be an increase in the number of institutions, whether through the creation of a new institution, the expansion of whether through the creation of a new institution, the expansion of a branch campus into a standalone institution, bringing an existing institution of higher education into the system, or consolidating 2 or more educational sites to form a new institution. Today, I would like to begin to spend a little time identifying some principles to guide the development of related policies, as well as the kinds of information we believe we will need to make a knowledgeable decision about system expansion. Our discussions today can help guide staff as they draft a regulation for the board's consideration at a future meeting. I think that this is a pertinent conversation for us to have, particularly since I think by December it is, Frank, that we have to present some recommendations to the Higher Education Coordinating Council about the status and I guess the future growth of the system. believe it or not, we don't have anything specifically in place about how we expand, and I think that with the anticipated growth and with all the changes in the landscape, it's important for us to come up with some ideas about what kinds of things are important to us and what kinds of things we're going to look to as we choose to expand the system to address some of the needs that we anticipate are coming down the pipe. So I don't know if you guys have any initial thoughts that you want to just put on the table, if you just want to just use that as the open of the conversation, or as to open the conversation. I just know we need to give staff some guidance on how to proceed. Any general thoughts? I guess one thought may be we have some existing branch campuses. Does it make sense to go ahead and allow those campuses to be standalone? One thought may be even do we consider having some of the state colleges become a part of our system? I mean, I don't want to give you an answer. I just kind of want to give you thoughts about the kinds of things that I think we're going to need to consider in order to deal with the changes in that higher education landscape.
May I? Yes, ma'am, if I can. There's a couple of parts to this, and I don't want to give anybody the impression the chairwoman had mentioned a regulation. One of the things that we're doing right now is looking around the rest of the country to see what systems and process other states use for expansion purposes. We're not the only growth state in the nation, and even states that have stopped growing at least have in place regulations or rules or a process that they use to reflect on how they might grow, when they might expand or change their state system. And so we have been looking around the country to see if we can find enough of those to be able to give the board something to consider. Now, this is not something you can solve with a regulation, but in the absence of any regulation, you're just pretty much making it up as you go along. So that's number one. I also don't want people to think that we have to first create and promulgate a regulation to begin the process that the chairwoman was talking about. We know that we need to first do a very introspective look at our current system and see at the end of the day what the possibilities are. That will require an organized approach to all of us working together as a system. But the idea of some sort of a regulation is to not identify what comes out of the pipe, but more as to what sorts of things we ought to be looking at and to by way of any reorganization at any time of the state university system, so that we're not just operating in a vacuum. And then the second part is putting together the effort, the organized effort to begin to examine what we are, what are our needs, and what the possibilities are for change in the future. So there will be two trains running down parallel tracks, because we don't want to hold off this process until a reg is created, but at the end of the day, all it's going to provide anyway is a shell, an opportunity to demonstrate that there is an organized approach to this thing. It has never existed before, and I will end by saying I had a conversation with a previous Board of Governors member a long time ago who was angry that the legislature was trying to change the system. And I reminded that individual that in the absence of any other process, that one was just as good as the one we had, which was non-existent. That you can't argue that changing the system through legislative fiat is a non-starter if we don't have a process for looking at how our system might change when necessary in the future. And that's what that would be all about, is just creating the regulation that would give the board the authority, when appropriate, to look at the system based on a variety of variables and how it might change going forward. But the bigger issue then, and that's where the chairwoman was headed, was then putting together the right people to actually take that look and come back with recommendations for what our needs are going to be and how we might fulfill them in the future.
Governor Colson.
Madam Chair, I think this is a great idea. We ought to have a process in place to consider new universities or expansion, or do you need a motion on this, or we can just go forward?
I think that we can just move forward with the conversation without actually having a full motion on the floor. That's what I'm thinking.
Okay.
And I look over to my left at Tico, who's the great process guy. But I'm thinking that we're good at. I need to at least have the body thinking about the concept, because we are we keep hearing the numbers, and it becomes a question of the need to expand, and we need to at least broach the subject in this committee, so that when we move forward with the issue, we would have had an opportunity to think about it and put it on staff's agenda. That's why if there are any thoughts you have specifically now that you may want to add, it'd be a good time to do so as we'll be working with staff through the issue. Dr. Marshall?
Madam Chair, you mentioned the Higher Education Coordinating Council a minute ago. I was interested in that council when it was formed and have been interested in its progress it's made, but I haven't heard much about it, and maybe I'm the only one in the room who hasn't. I would be interested in, I know the Chancellor is heavily involved. Could we have a brief report on the Higher Education Coordinating Council and what it's been up to?
Yes, sir. As you all know, the Higher Ed Coordinating Council was created 2 sessions ago. There are the representatives from each of the higher ed delivery systems, both public and private, as well as the State Commissioner of Education representing, pre-K through 12. 2 laypersons, one given to us by the House, one by the Senate. Our job is not to become a regulatory board. Our job is to be an advisory board back to our different delivery systems on a wide variety of issues. I mean, the noble intent of the group is to try to help articulate delivery systems that in many ways continue to operate in silos. Even though there is a cross-pollination, oftentimes we've got different delivery systems that aren't really coordinating their effort with the others. So we have been meeting for about a year and change. We meet quite regularly, I can assure you. And right now we've got 3 things going on in the hopper. One is we're working with all the workforce folks to take a serious look at the workforce needs of the state of Florida now and in the future, just to get a better look at what we do and is it aligning, whether we're public or private, with the workforce needs of the state of Florida, so that as we do our job of strategic planning, we can have that available to us to make sure that we're not just shooting in the dark. And we're looking at what I've continued to call the 3 E's. Those industries that are existing, those that are emerging, they're here, but they're just getting started, if you will, and then even those that we can look over the horizon perhaps and begin to see what's out there, and is Florida prepared to take those on. That can help all of us with the issue of programmatic delivery and making sure that we're not oversaturating markets and that we're not undersubscribed in areas that are going to be important to the state of Florida. Second, we are completing, although there's still work to be done on it, a significant online inventory of all programs being offered public and private in higher education in the state of Florida. If you recall, Richard was here 2 meetings ago and did a brief illustration of that in its basic and early form, so that someone could go online and whether it was for economic development needs or even programmatic needs, and see in a geographic area of Florida who is offering what program and in what areas, public and private. So that, for example, if the governor is going to go off and look to bring business to Florida, the governor can have a well-organized portfolio of degree offerings if he's going to meet with someone in the biotech industry. Who in Florida is offering what biotech courses and curriculum, et cetera. And also it will help us as we look at our program alignment to see who is doing what where. The job now is, and Richard and his folks are working on it, is to make it as user-friendly as possible so that it's easy to work around, it's easy to access, and it's in a format that makes it user-friendly. So we've been working on a number of initiatives. Last meeting was at St. Pete College, and we took the opportunity there to look at program alignment, to use St. Pete as an illustration of how multiple delivery systems, public and private, have come together to coalesce on one campus to be able to offer a significant number of programs to students in the St. Petersburg area. To the chairwoman's point then, as we continue to meet, ultimately what we need to do is have a good vision for Florida of our workforce needs and to be able to then make recommendation back to our boards as how we organize our academic programs to that end, as well as, and this is the most recent point, how we actually organize ourselves logistically by delivery system to make that happen. And what the chairwoman was alluding to is that by December, what they've asked us to do is have some general idea of where we are as a delivery system logistically, and see if there are possibilities of altering that delivery system to create greater access down the road. So again, I'll end where I started and say this is an advisory group. They do not make policy, but they help us to be able to align the policy-making groups of the state of Florida at all educational levels. I hope that helped.
Does that help, Dr. Marshall?
Yeah, it's very helpful, Mr. Chancellor. You mentioned you didn't mention by name the state college system, but you talked about a survey that would include their offerings.
Yes, sir.
I noted in the reports yesterday from a couple of the universities that they have significant numbers of transfer students, and it's clear that the enrollment of some of those colleges, some of those universities, is made up heavily of transfers from the state college system. And it seems to me we ought to look at the possibilities for some integration of programs, or at least being aware of what the state college system is doing as we attempt to serve the needs of all of Florida's young people.
Yes, sir. Actually, I've asked if the chairs, we have co-chairs on the Higher Ed Coordinating Committee, if I've yet to talk to the chairwoman about this, but at some point in the fall, ask for the representation of the Higher Ed Committee to actually come to one of our meetings and have this broader conversation. We really need to interface with them beyond just me. It would really be great. I should also point out that the chairwoman was in St. Petersburg at that meeting representing the Board of Governors. So you are well represented, but I still think it would be a great opportunity to have the leadership of the Higher Ed Coordinating Council hear these conversations and be engaged in those directly with you.
That's helpful, Mr. Chancellor. Thank you very much.
Yes, sir.
Governor Duncan?
Just one thing that I would like us to look at as we look at how we expand is not just meeting the access demand need, but also what's the cost effectiveness of the various models. You know, I mean, is it cheaper to do just bigger, or do we reach a certain point where it's cheaper to be a certain size or not? And if there's any national models or information on that we can also weigh into that consideration, I think it would be very helpful in coming to a good conclusion.
Governor Beard?
I just want to ask a question. If we wanted to start another university, do we have the authority? How do we work with the legislature? How do we get the funding? Can you kind of walk through that?
Well, of course, you have the authority to designate and to recommend budgets to support, and ultimately the legislature has to decide if they want to support that legislative request. So if you decided, for example, that you wanted one of your current campuses to expand, you would have to create a proposal and then a legislative budget request to support that academic proposal, and then take that to the legislature. And of course, the legislature would have to decide if they wanted to support that or not. Does that make sense?
Yes,
okay.
There's a multiple process.
Yes, sir. It's a partnership at the end of the day.
So I think that, Frank, you've given some directive about, what we would like to see as it relates to a regulation regarding expansion, as well as the process that we could follow, even, I guess, whether we have the regulation in place or not, as far as how we may proceed with the issue. So with that, I'm going to close that part of the close that agenda item. I just needed to get the conversation going with the idea that in the very near future we'll address the issue, particularly as we respond to what we need to present to the Higher Education Coordinating Council, as well as I think what we need to do in order to address some of the expanding needs within the state. I think that is the last item that is on the Strategic Planning Committee agenda. Donna, just please make sure that you work very closely with Governor Martin and Governor Root so that they are aware of some of the items that we addressed here. And additionally, as I stated before we leave today, I will make the announcement regarding the task force to deal with the regulations. So with that, I'm going to adjourn the Strategic Planning Committee and pass the gavel down to Governor Husseini for the nominating committee.